when a patient comes to visit us at the dental specialist, oftentimes people have 4 primary questions. First is, how long does it take to get an implant, right? Start to finish, and sometimes how long is it gonna take in the chair procedurally? How much is it gonna cost? How much pain they're gonna be in during the process or thereafter, and if they're gonna leave the office in a temporary. With regards to how long it's gonna take for a patient when they're in the chair on the day of surgery, that can vary. Of course, it's based on the amount of implants that we're placing, the individual needs of the patient, right? Whether we're doing sedation or not. But typically, it can range anywhere between 45 minutes to 2.5 hours. With regards to the overall process, from start to finish, usually there's a 3-month wait between when the titanium post gets placed in the gum to when the final crown gets positioned on top of that titanium post. So another question people have when they come to us is, how much is this going to cost? And that answer is that cost is varied, depends on the clinical need, depends on how much bone is available, depends on whether we need to move teeth to be able to accommodate the space. A lot of times people have come in and their teeth have shifted or there's been bone loss and we need to do things before we even get to the implant stage. Big question is this going to be painful? And the reality is that a lot of people opt for some form of sedation, and in addition we give a lot of Novocaine, but literally no pain. Some sensations of vibration, but not a true sensation of pain. After the fact, the amount of pain that someone experiences is entirely based on their pain threshold. What I typically find is people are comfortable managing their pain just with over-the-counter medications. And again, we do provide the low-dose narcotics just to provide an ease of sleeping the first couple nights. Another question that we get a lot is, will I leave with a temporary at the end of the surgical appointment? So our goal is to make sure that no one feels self-conscious after the surgery while they're waiting for their permanent crown. Those options can range from a removable tooth, and other times we will bond in or glue in teeth so that they become more permanently affixed temporaries. And there are some clinical scenarios where we can actually connect a temporary to the actual implant on the day of surgery. The best way for us to answer those is for you to call and schedule an appointment. It's the best way for us to get the ball rolling.